Good morning, guys. So, today we will be seeing what is medical coding and how we are going to learn it. Okay, what all things we are going to learn in medical coding and what all things we are doing in the course structure as well as entire medical coding cycle. What is the medical coding cycle? So, these are the things what we are going to see it in the particular this particular presentation. Okay, guys. So, let us move forward. So first, what all things we are going to learn today? So today we will be learning what is a basic understanding of a structure of a medical coding, as well as what all things are included in the syllabus, what are the different coding types, what are the different specialities in coding, as well as gain the knowledge whichever like how which all books we are going to use, then which all what all are the type of the documentations which is being presented, as well as what all tools and what are the certifications which we are going to get it in the particular area. So let us give an introduction what is medical coding. So US healthcare is a very vast healthcare sector in which we will be using this coding is coming as a outsourcing process to the Indian companies. Okay, so it is a very great field or great opportunity in which you will be having all the like a very good career growth. So now, what is the RCM cycle? So, RCM means revenue cycle management. So, what is RCM cycle? So, this particular cycle will give you the idea what happens in this particular US healthcare. Okay, so that is where it is being issued. Okay, so where is the role of medical coder is coming? Where is the in that particular entire cycle, where is a medical coding, what is the importance of medical coding, and all these things if you need to understand means we have to first understand what is a RCM cycle. So in general, RCM cycle means the patient will first come to the physician, that is called as encounter. So from the encounter, okay, so from starting from the visit of the patient to the physician doctor. Okay, so in simple terms, we are a patient, I'm a patient, I'm going to the doctor to visit the doctor, okay, for getting a consultation. So we are going to the physician, so that is called as encounter. Then from the encounter, so many things are happening in between. Okay, so many steps are there that I will explain you later. So from the encounter, after the encounter of the patient, the claim is being prepared, and the claim will come to the coder. Okay, so the claim will come to the coder, and the coder will assign the claim, like will analyze the claim. Okay, and we will be assigning all alpha numerical codes to the particular claim. Okay, and this after assigning the alpha numerical codes to the claim, it will be going to the billing section where a biller will decode it and assign the amount which is according to the code. The amount is decided according to the code which we are coding. Okay, and this amount will be billed, and it will go to the AR follow up. From AR follow up, accounts receivable department, it will go to the AR, and from there it will go to the payment of the particular claim to the doctor or the physician. Okay, so this is a major thing which is happening in US healthcare sector or in the process of RCM cycle. RCM means revenue cycle management. Okay, so this is a what we are going to do it in this. So here the assigning of the codes, analyzing the medical report, assigning the codes, determining which code has to be assigned, and like all those things are done by the medical coder, which is a very very important step in the RCM cycle because all other steps are based on the coding. Okay, guys, so this is how the RCM cycle will be managed. So now, what is medical coding? So medical coding, so I said the encounter of the patient to the physician will happen first. Okay, so now the claim has been prepared. Using the claim, we will be using the code. Set of books are available for us. Okay, different books are available for coding. Using that, already analyzed, already set codes are available. So we will just analyze the medical report, we will take the codes, and we will be assigning the codes. Okay, so medical coding is basically a transformation of diagnosis, procedure, services, equipments, etc. into acceptable, transferring all these things into acceptable alphanumerical codes. So, what all things we are going to code is, we will be coding diagnosis. Diagnosis means the disease of the patient. Whatever disease the patient is having, that is considered as diagnosis. Then procedure, what the physician has done to the patient, that is called as procedure. So for procedures, we will be assigning codes, as well as during the procedure, the physician will provide different kinds of services, different kinds of equipments will be used. So all those things also we will be coding, and we will be assigning all these codes into alphanumerical or numerical codes. Okay, which is available already, it is standardized and set by the organizations, and we will be assigning these codes to the particular patient's claim, and this will be going into the revenue cycle management. This is what basically a medical coder is doing. So what are the different benefits of this medical coding? So why we have to do it, what are the different benefits? The first thing is that this is basically done for getting the reimbursement for the physician. Okay, so physicians is our client, so physicians, doctors is our client. So we are doing it for them to get their basic reimbursement procedures. Okay, so that is the first thing what we are why we are doing medical coding. Second thing, a statistical analysis of a disease and treatments can be recorded. It is recorded in the things. Okay, so that if any pandemics events are there, or if any outbreaks are there, all these things can be analyzed very easily. Easy tracking of the pandemic situations, anything is happening means we can analyze the situation. Diagnosis is very important. So whether the treatment is a medical necessity or not. Okay, simply they are doing the treatment, or is it really required for the patient? All these things can be analyzed by just seeing the diagnosis codes. Okay, so that is also very easy. Then the fourth one is that easy storage and access of data. So when it is assigned as codes, okay, so it is a easy storage of the medical claims is happening. And whenever you want to refer a medical claim, or whenever you want to take it back, we can always analyze it and take it back. So whenever it is required, we can always retrieve the back the particular data of the patient. So that is a one easy thing. Then patient can get the treatment in any hospital. So once you have the insurance, it is not, see, in the particular abroad condition, especially in US, we are doing US healthcare only. So especially in US healthcare, the entire medical system is working on the basis of insurance policies itself. Okay, it is not at all like our country. So our country, we will be going, we will be paying directly, and we will be coming back. But the difference is that there it is entirely based on the insurance things, and nobody is going to pay from their pocket. So that is a basic difference. So now here also we are also developing into that particular area. Now the widely we are using the insurance in our country also. So basically soon, here in future, soon, this medical coding will be applying to our country also. Now itself, many changes has happened, like bigger organizations like Aster Medicity or Apollo Healthcare, all those things, all those already has converted to insurance itself, and medical coding has been already started in all these big organization hospitals. So soon we will be also going into this particular thing only. So medical coding is a very big field which is going to boom in future, because as a coder, as a medical coder, we are going to have a n number of opportunities in the coming next two, maybe 3 years, or 2 years or something like that, in a span of 2 to 3 years. So we are also going into this particular area where we will be also doing it on based on the insurance. So that is the next thing. So the benefit of the insurance is that the patient can get the treatment in any hospital. It is not he has to go only a limited thing. No, he can go to any hospital anywhere and he can get the treatment. So that is a basic advantage of medical coding. Then coding can decrease the fraud claims, and fraud things, fraud activities and all can be, no extra charges can be added to the claims, nothing like that. Those kind of things can be eliminated because it is all going through the insurance. It is internationally standardized, and it that fraud, extra charges of the treatments and all those things can be avoided due to the coding field, okay, when coding is coming into action. So these are the different benefits of medical coding. So now, really, this these many steps are there in revenue cycle management. Okay, so the first one which is happening is the patient is coming to the registration thing. Okay, so that is the first point which is happening. The patient is coming to the registration, and from the after the registration of the patient, what happens is it will go for a eligibility check, because the insurance has to be checked, right, whether the patient is eligible for the insurance for that particular treatment and all those things. So that will be done. Then the doctor, the physician, the doctor will treat the patient. Okay, he will treat the patient. After treating, the claim is being scanned as a electronic claim. Okay, so this electronic claim, in that they will be entering all the demographics entry. So what all are the demographics entry? So like patient's name, age, insurance of the patient, which insurance he is using, like that all the details of the patients will be entered, and also the treatment of whatever, what is the diagnosis of the patient, what is the treatment provided, what all things he has done, everything will be entered in demographic sheet. Okay, so this electronic claim will be coming to the medical coding, okay, coder. So it will be coming to the medical coder. Yeah, so from there, from that medical coder, the coder will assign the codes which is already standardized. Okay, and we will be uh, uh, assigning it. Okay, after assigning, it will be in the queue. Okay, it will charge entry is the queue which is being before submission, it will be waiting inside the queue. After that, it will go to claim submission. Okay, the claim will be submitted. After submitting, it will go to the posting area where the charge posting is done, that is billing section. Okay, so from the billing session, if everything is okay, like all the codes are correct and the billing is correct, it will go to the AR follow up. Okay, accounts receivable management, it will be going there. Otherwise, it will go to the denial management. Okay, if it is denied, it will go to the denial management. From denial management, it can come back again to the medical coder. Okay, if to check whether it is a problem of coding or the claim preparation. So the medical coder will once again check with the claim. If everything is okay, or if the coder requires more details or something, he will ask the physician to send the more details of the claim. Okay, so and then the coding will be corrected, it will come again to the charge posting. From there, it will go to the AR follow up. Okay, from AR follow up, it will go to the reimbursement of the physician, and finally the physician receives his reimbursement, his remuneration. Okay, so this is a revenue cycle management which is happening in US healthcare. So now, basically, how to code. So basically, in the coding, we will be basically using, that, especially outpatient coding, we will be using three major books. Okay, so the first one is called as CPT. So CPT is called as current procedural terminology. Okay, current procedural terminology. Yes, CPT is called as current procedural terminology. Okay, so that is what is called as CPT. So what we are basically coding using CPT is what the provider did, that is the procedure. what the provider did. Okay, then we have HCPCS book. Okay, the second one is called as HCPCS book, which we will be taking us what the provider used. That means he will be using some injections, he will be using some materials to do the procedure, right? So for that is coded using the HCPCS book, Healthcare Procedure Coding System. Healthcare Procedure Coding System. That is what is HCPCS code. And finally, ICD-10-CM, International Classification of Diseases, 10th edition, clinical modification. Okay, so here why the provider did and why the provider used. So it will be explained using ICD-10-CM. That is your disease coding. That is your diagnosis coding. Okay, so that is what is basically what is called as ICD-10-CM. So now I'll tell you an example. Hmm? So this is an example. For example, urologist. Urologist is a physician who deals with the urinary system of the patient. So the patient is having a urologist, the patient with the bladder cancer. Okay, simply bladder cancer, urinary bladder cancer, performs a bladder installation. Okay, he is doing a bladder installation of 1 mg bacillus calamite urine to treat the cancer. Okay, to treat the cancer. So what all things a medical coder will assign, I'm just showing you the things, but we will be learning everything in detail. So first, what the provider did, he did a bladder installation. So for that we have a code that is 51720. Okay, so this is a numerical code, you can see it is a numerical code. Okay, so you can see it is a numerical code and that will be a procedure codes. Okay, 51720. Then we have HCPCS code, that is what he used. So once again I'll read it. A urologist diagnoses a patient with bladder cancer, performs a bladder installation of 1 mg bacillus calamite urine, that is BCG. It is a um, it is a drug which is used to treat the tumor, right? So he is using a drug. So for that drug we will code it using HCPCS book level 2 expert. So that is J9030. It is a alpha numerical code, you can see it is a alpha numerical code. Then we have the tumor, the bladder cancer. So why he did it, why he performed it, okay, why he used it, everything is explained using ICD-10-CM code. That is because of bladder cancer. So for that bladder cancer we have a alpha numerical code again, C67.9. Okay, C67.9. So like that we have a code for the diagnosis also. So this is how, this is what a coder has to do. So when a thing is coming, when a medical report is coming, we have to see what is the diagnosis, what is the procedure, and what he has used to do that procedure. So all the three things we can code it using our thing. So this is the work of a medical coder. This is an example for that. So we will be learning in detail for all these examples. Okay, so now the next thing which I am going to show you is, that is what we are going to see it here. So first we will be learning the introduction to anatomy, because anatomy is a very very important thing in our section, because only if you understand the human anatomy and different structures and functions and pathology part, you will be able to you will be able to analyze the medical report. So you need to analyze your medical report, right? So for that we will be having we will be seeing first the details of anatomy. Okay, so the basic things, basic structure of each anatomical system, as well as the all the what all structure, the function of the particular system, as well as some of the common pathologies, not everything, but some of the common pathologies which is coming in each area. So each system we will be analyzing. Okay, so first is dermatology, that is dealing with integumentary system. Then ophthalmology, then otorhinolaryngology, pulmonology, cardiology, like that, all the system, each and every system of our body we will be seeing. That will be the introductory part for the anatomy. After anatomy, we will be seeing about the diagnosis coding. That is, I said, when I said the book, I have already told you, ICD-10-CM, International Classification of Diseases, 10th revision, clinical modification, right? So for that, we will be seeing the ICD, each chapter, like there are 22 chapters in ICD. Okay, so each thing we will be seeing in detail. What are the things, what all we have to code, how we are coding, why, like while coding the diagnosis, we need to see some of the guidelines. So there will be some set of rules and regulations, right? So before going into coding area, so how we will code is based on some set of rules and regulations for each set of coding. That is, for diagnosis coding, for procedure coding, for materials and supplies. So for all those things, we will be having a set of guidelines. So we will be seeing in detail of all the 20 general guidelines of ICD-10-CM, and as well as the set all the 22 chapters, like each section it has been divided. So for all the 22 chapters, we'll be seeing all the guidelines, okay, and each section by section we will be seeing that. After the 22 chapters, then we will have the introduction to CPT, that is the procedural coding, current procedural terminology. So for that, we will be using certain set of modifiers. So we will be seeing what are modifiers. Then each section, surgical section. So for surgical section, again the surgery section is divided into different anatomical portions. Okay, so first one is for integumentary, second one is for musculoskeletal, third one is for respiratory and cardiovascular, fourth one is digestive system, fifth one is genito-urinary system, that is all your reproductive system as well as your urinary system. Sixth one is endocrine as well as neurology, eye and ear. Okay, everything together. So for each surgical area, we will be having different six chapters are there. After that, we have certain services are provided, not only surgery, right? Procedure means not only surgery, but the services also. See, the physician is seeing the patient, and physician is seeing the patient, analyzing the patient, taking some decisions, giving prescriptions. All these are considered as services, so that is considered as evaluation and management services. Then anesthesia, for an anesthesiologist is performing certain things, no? So for that also we will be providing some things. Then radiological services, pathological services, general medicine services. Okay, so that constitute of the second book, that is our CPT. Then finally we have one book that is called as for supplied materials and all those other services, like certain injection procedures and all. So for that we will be doing with HCPCS. HCPCS is healthcare procedure coding system. So with that, we will be completing our CPC training. So these are the topics which we are covering in our CPC training.